Joined now by clinical psychologist Alan Lipman. Dr. Lipman, nice to see you today.
How are you?
You know, family and friends here are at a loss to explain Edward Van Dyke's horrifying actions. Yes, he'd been having problems with his wife. He had a stressful job as a radiology oncologist. Apparently he was dealing with kids with cancer.
That's right.
But to take his own kids' lives, what could have possibly been going on?
Well, this wasn't caused by mere job stress. He actually was the director of the radiation oncology program in Alton, Illinois. But I think the key here, you know, people ask a question about Van Dyke. How could such a successful man commit this horrifying, tragic act for himself and his children? Well, like so many things, Contessa, success on the outside is not success under the surface. He was at Dartmouth before he went to Alton. He had only been in Alton for about 18 months. And according to colleagues at Dartmouth, he had had a very rocky career. Confrontations with colleagues, didn't quite fit in. Here's what I think happened, and I've seen cases like this before. I think that, you know, new job, new move down. And after a rocky career trajectory, starting to fail. Pressure on himself, pressure on the marriage, they start to fight. You know, mere job stress doesn't make a man do this. What makes a man do it, and we've seen it in cases like Mark Barton, the stock trader who did this a few years ago, are shame and rage. Feeling like you're failing and you can't escape, and so you don't want to admit your failure to your family, and rage at the wife or the other close person who is betraying you. We've got marital difficulties here. I think what happened was he couldn't face it, and he blamed his wife, and so he took his kids with him to wreak havoc and vengeance on her and to escape the sense of failure that he felt.
And you mentioned his move, too, and obviously when you move to a new place, you also don't have a social network, a support system
That's exactly right.
set up in place as well. You know, I'm curious, though, you have this professional guy in a new job having troubles at home. Surely there were warning signs. Surely. What should people at home be looking for? You
know, I love this question because I've talked with other people about this case, and this was a preventable tragedy. One of the people that I talked with previously about this today said, how could he do this? He was a doctor. He was so successful. I think the veneer, the categories that we place on people, you know, he's a doctor, how could he feel troubled, often blinds us to the actual stress that anyone can feel in their marital life and in their work. And I think in this case we had someone who already had shown warning signs, confrontations at work with other physicians. This is, you know, a rarer thing than you might expect it to be. Difficulty fitting in, and then the marital difficulties. You know, I suspect that the wife had seen some of this rage before, but of course whoever thinks that it's going to erupt in this kind of horrific and murderous tragedy.
And when do you ask for help? When do you as the wife, or when do you as the coworker say, I think we might be in trouble here, we need help?
Well, obviously it depends on the setting and the resources, but as a general rule, and it's an excellent question, the first thing you do is go to the person. And in a confidential setting, one-on-one, you say, look, I'm noticing this about you. I'm worried about you. It's not blame. I'm not going to tell anybody else right away if you get help. You wait a couple of days, nothing happens, then I think you have to go either to an EAP, to an Employee Assistance Program supervisor, to another supervisor, and express your concerns. You know, some of the time people don't take care of themselves. I'll bet you know people like this, Contessa, and we got to take care of each other. This was a preventable tragedy.
It's hard to hear you say that, knowing that 2 little kids are dead and their mom
4 and 8. 4 and 8.
Going to have to live the rest of her life. I mean, it's just incredibly sad. Psychologist Alan Lipman, thank you so much. We really appreciate your insight today.
You bet.
A deadly drug cocktail has killed 3 more people in Detroit.